been about 10 years with migraines, and again, like usually throughout the year I'll get a few bad ones, or maybe once a month I'll get a bad one, and then there's always that wave like once a year that it's just like a constant migraine for a couple of weeks, and then I will go to urgent care, my primary care provider, or I've been to the ER a few times for it too. A lot of them, I would be able to take some, rizatriptan or some kind of pain medication, or even Tylenol or Advil, and it would kind of subside a tiny bit. But when they were really bad, they were really bad, and I couldn't do anything. I was just in bed, nauseous, sick, couldn't really move, couldn't go about my day-to-day life, couldn't do any kind of activity. And a lot of the times those really bad ones came out of nowhere. So which was really frustrating about any kind of medication I was on, is a lot of migraine meds are like, if you think you're about to get a migraine, take this medication, but there was no thinking about it. Like by the time it hit me, I was down, you can't do anything with them. It's like 10 out of 10 pain. I was really discouraged with my migraines when I started seeing you, because they were interrupting my life so frequently. As I have high goals and high expectations for myself. I would really like to be a prosecuting attorney someday, or a judge or something like that. And those aren't really things that you can sub out on all the time. Like, oh, I don't feel super great, I'm not coming in today. And so it was one of those things where like a professional career seemed kind of far away from achievement when I first started coming here, because pretty quick after I started working with Momentum that we were able to diagnose a lot of causes of my migraines. They're not as random as I thought that they were. I can usually pick up and like, oh, okay, this is what I did, and I think that's what made me have a migraine today. Now that I know what causes migraines, we've really decreased them significantly. I am really confident going into law school that I'll be able to have the career that I want. What I wanted most with my migraines was an answer to them. What was causing them? Why do I get them? What triggers my migraines? Because for the longest time they were just so random, and they came out of nowhere. I didn't understand why. I would try to look for patterns, and I didn't quite understand. But after coming to Momentum and figuring out, hey, like we think it's this, and this might spark it, and kind of keeping an eye on those things and keeping an eye on those habits, that provided an answer. And that was the biggest thing I was looking for. Said, like, people don't necessarily think of physical therapy for migraines, but it has helped me significantly. So I think the best advice I can give is don't settle for your treatment. If you're not seeing progress, try to see a different provider, or talk to your provider and say, hey, like, I'm not seeing progress with this. I don't want to just cope. Staying even the level that I'm at right now, I'm really functional. I'm able to do things, I'm able to work, I'm able to get through a 40-hour week, I'm able to complete school, I'm able to succeed in school. So as long as that remains the same or even improves, I really think I have a bright future. I don't think that migraines are limiting my life anymore.